Hello friends, I'm Dr. Nikita Deshmukh. Today it is World Cancer Day. As an ENT and head and neck surgeon, I would like to communicate with you regarding those cancers of these relevant specialities. So in our practice, we see oral cancers, throat and laryngeal, that is the voice box cancers. My observation is in our scenario, the oral hygiene is very neglected part. So because of that, what happens is like the bad oral hygiene, misdirected teeth, these are very important predisposing factors to oral malignancies, especially the cancers which are related to the tongue and the cheek. Most probably what happens is misdirected teeth act as a friction factor, and because of that ulcers are produced. And whenever there are ulcers and they are continuously going to be irritated by these misdirected teeth or some factors of bad oral hygiene, then oral cancers happen because of the constant irritation factor that is in the mouth. The other risk factors all of us are aware about, like tobacco chewing, gutka, smoking. So these factors are also very important factors, and so it's very important that you quit smoking if you are into the habit of that. Now, before cancer, there are certain other conditions also which come in the mouth, like discoloration in the oral cavity, which is called as melanoplakia, which is a blackish discoloration, or leukoplakic patches. So these are also pre-malignant conditions which should not be ignored. The other important factor which most of us miss is hoarseness of voice. Whenever there is hoarseness of voice, it is written off as just an infection or an ongoing thing. But if this hoarseness of voice is persistent, it is continuously there for months together, then you should not ignore it. It's important to see an ENT specialist and get a laryngeal examination done. So now we have a lot of techniques like the laryngeal endoscope, which is an angled scope, and it gives a beautiful view of the larynx. So there is this procedure which can be done under local anesthesia itself, like with the xylocaine spray put in the throat. The examination can be done, and these kind of cancers can be diagnosed at an early stage. It's not just cancers, there can be other factors also, like chronic laryngitis, vocal nodules, but today I would mainly like to focus on oral malignancies and the voice box cancer itself. So if we are able to catch this at a very early stage, what happens is that the treatment becomes relatively simple. Radiotherapy options are available for laryngeal cancer and the results are excellent. So early diagnosis is always, my friends, the key. So please do not miss the important signs, like if there is an oral ulceration which has been there for a long time, it's not healing, or if there are other factors also like change in voice, lumps in the neck, lumps in the oral cavity, ulcerations, bleeding gums, you should see an ENT specialist and get your oral checkups, the dental checkups also, oral cleaning, scaling, treatment of the misdirected teeth frequently, at least every 6 months. That is what I would recommend. Thank you.